Hello everyone, my name is Haley and I did my genetic disorder presentation on sickle cell disease. So first thing, what is sickle cell disease? This is a genetic disorder that affects the hemoglobin, and hemoglobin is the red blood cells and they are responsible for delivering oxygen throughout the body to different tissues and organs. This sickle cell disease, the mutation causes the red blood cells to change their shape from the normal circular shape to the sickle or crescent shaped. And I'll show you a picture of those in a minute. And just a little brief background on hemoglobin, if you're not 100% familiar with what it's made up of. It has four groups. It's got two heme groups and two globin groups, and each group has an alpha and a beta. So within the globin groups, there's the alpha globin and the beta globin. And sickle cell disease mutates the beta globin and mutates it into a hemoglobin S. So this is just a diagram to show you what happens within the blood vessels with those sickled cells. So as you can see on the bottom, the normal red blood cells will flow nicely through the blood vessel, whereas the sickle cells kind of build up and cause blockage. Little background on sickle cell disease. So it originated in Africa and has been present for over 5,000 years. And it is believed to first been discovered in the United States by Dr. Herrick in around 1910. And the story behind this is there was a dental student from Granada that was studying in Chicago, and he began to show symptoms of anemia. So Dr. Herrick was a cardiologist, and he studied this dental student's red blood cells under a microscope, and that's when he first discovered this sickling shape instead of the normal round shape. And then in 1927, Hahn and Giuseppe, they discovered kind of the difference between sickle cell trait and sickle cell disease, which I'll go more into shortly. But they basically saw that if you removed oxygen from a red blood cell from a person that had this disease, this is when you would create the sickle shape. So then they took this information and they tested patients' family members, so patients that were positive for sickle cell disease. They tested their family members, and in some cases, they saw that even if a person tested negative for the disease, they still had this sickling happen when they removed the oxygen. And that's how they discovered that you can still have symptoms even if you don't test positively for sickle cell disease. So the prevalence of sickle cell disease, it's most commonly found in areas with frequent malaria cases. So initially, the reasoning behind the mutation is it does help build up an immunity against malaria. So if you have sickle cell disease, you won't get malaria, but consequently, you will have long-term side effects and symptoms that you'll have to deal with. So these areas are Sub-Saharan Africa, South America, Caribbean, and Central America. And approximately 100,000 Americans have sickle cell disease. And just some other interesting facts. 1 in every 365 African Americans have sickle cell disease, and pretty commonly about 1 in 3 African Americans have sickle cell trait. So a little bit more on the disease versus trait. So if you have sickle cell disease, you will have the 2 recessive genes and be considered an affected individual. However, if you only carry 1 of the recessive genes, you're not considered an affected individual, but you can still have signs and symptoms of sickle cell disease. So you can still have some sickling crises. They're usually not as severe as someone that has the 2 recessive genes. And most of the time, you can live a pretty normal life without ever having any signs and symptoms. But it is important to be aware if you are a carrier and that you do have sickle cell trait. 1, because you should be aware that you can pass this on to one of your offsprings. And another reason is if you have sickle cell trait, you need to be careful when working out because any exertion, heavy exertion, can put you more at risk for these sickling crises. So some characteristics and signs and symptoms of sickle cell disease. During the sickling crisis, your red blood cells break down, and this is the anemia. Anemia is just the low number of red blood cell count. Some symptoms of this are shortness of breath, fatigue, jaundice, which is just the yellowing of the skin and eyes. You can also have severe pain associated with this, and this happens mostly when, if you remember back to that diagram I showed you earlier, those sickle cells get stuck in the red blood vessels, and when this happens, delays the oxygen being delivered to the tissues and organs, and then this can eventually lead to organ damage. And then usually with sickle cell disease, the person will have high blood pressure, mostly because of these blockages that happen, and then this ultimately can lead to heart failure. So the molecular cause of sickle cell disease is a mutation in the hemoglobin beta gene, like I described earlier, which is located on chromosome 11. And what happens is this mutation creates the new subunit called hemoglobin S, which is, like I said before, replaces the beta gene with the hemoglobin S. And then this, instead of allowing the 4 units to work together, causes the subunits to kind of stick together, and that's what creates that sickling shape rather than the round shape. This is a missense mutation because this mutation, it substitutes the adenine for a thymine, which causes a change in the amino acid created. So the mode of inheritance is a recessive autosomal inheritance, kind of like I said before. And a child will inherit the hemoglobin S gene from each parent. And then, like I said before, if they get the one hemoglobin S and one normal hemoglobin A gene, they will develop sickle cell trait. So this is just a pedigree showing how this sickle cell disease is autosomal recessive. And as you can see, the founding parents at the top there, Julie and Scott, both are not affected by the disease, but they are both carriers, so they would each have sickle cell trait. And then their one son, Logan, does have sickle cell disease, and it just kind of shows how it can affect a family there. So types of testing that can be done. The carrier screening is the main test. This is just a blood test, usually given to each partner prior to conception to determine if they are a carrier or not. And then if this first blood test comes back and the person has a low red blood cell count, or if they are of African, Mediterranean, Middle Eastern, Southeast Asian, or West Indian descent, they will do a second blood test. Mostly because those are the places, like I said earlier, where sickle cell disease is most prevalent. And if you are pregnant and would like to know kind of if your child has sickle cell disease, the amniocentesis or chronic villus sampling can be performed. And actually now in the United States, it is mandatory for all newborns to be tested for sickle cell disease between the first 24 hours to 48 hours of life. And this has been effective since 2006. Some treatment for sickle cell disease. Currently, a bone marrow transplant is the only known cure for the disease. However, for this to happen, the sick patient needs to have a matching donor, and it needs to be from a healthy sibling. So this is really hard to find because usually if a person has sickle cell disease, their sibling usually has the sickle cell trait, so they wouldn't be considered the healthy match. So it is really hard to find a match for this. There is also a drug called hydroxyurea, which helps reduce the pain associated with the sickle cell disease, as well as the need for fewer blood transfusion. And just living a healthy lifestyle, staying hydrated is going to be one of the biggest things that you can do to kind of help prevent this. And lastly, I just thought this was a fun fact here. The NCAA actually requires all student athletes to be tested for sickle cell trait prior to being allowed to participate. And the main reason for this, I kind of touched on it earlier, is that if you have sickle cell trait, you are able to live a normal life, but you are at a higher risk for exercise-induced like rhabdomyolysis or sickling of your cells, in which you'll have the high pain, which can lead to the blockage and organ damage. So this is, the NCAA did this really just to provide more safety for the athletes, and so that healthcare professionals are aware of which athletes have sickle cell trait, and they can be kept in, have an extra eye kept on them, or if they start developing these symptoms, they should sit out immediately there. Okay, and here's my references page. So thank you everyone for watching my slideshow on sickle cell disease, and I'm looking forward to learning more about your diseases as well. Thank you.